Introduction. Welcome, future medical professionals, to today's lecture on the fascinating field of endocrinology. Today, we will delve into the intricate realm of osteoporosis, a common yet often underdiagnosed condition affecting millions worldwide. Osteoporosis is characterized by decreased bone density, increased fragility, and a higher risk of fractures. In this script, we will explore various aspects of osteoporosis, including bone turnover markers, genetic determinants, and therapeutic strategies. Join me on this educational journey as we unravel the complexities of this debilitating disease. Now, let us begin with our first topic. Osteoporosis is primarily a disorder of bone remodeling, a lifelong process involving bone formation and resorption. To assess the dynamic changes in bone metabolism, bone turnover markers serve as vital diagnostic tools. These markers are categorized into two groups: bone formation markers, such as osteocalcin and procollagen type 1 N-terminal propeptide, PINP, and bone resorption markers, such as C-terminal cross-linking telepeptide of type I collagen, CTX, and tartrate-resistant acid phosphatase 5B, TRP5B. Monitoring these markers helps to evaluate disease progression, monitor treatment effectiveness, and predict fracture risk. However, it is important to consider factors that may affect these markers, such as age, sex, renal function, and medication use, before interpreting the results accurately. Moving on to our next topic. Genetic factors play a significant role in osteoporosis susceptibility, accounting for approximately 70 to 80% of the variability in bone mineral density, BMD. Genome-wide association studies, GWAS, have identified several genes associated with osteoporosis, including but not limited to the vitamin D receptor, VDR, estrogen receptor alpha, ESR1, and the low-density lipoprotein receptor-related protein 5, LRP5. These genetic variants influence various aspects of bone metabolism, such as calcium homeostasis, estrogen signaling, and WNT signaling pathways. Understanding the genetic determinants of osteoporosis provides valuable insights for risk stratification, early detection, and individualized treatment approaches. Let us proceed to the next topic. Although commonly perceived as a disease affecting predominantly postmenopausal women, osteoporosis in men is a significant health concern. Men experience a gradual decline in testosterone levels with age, resulting in increased bone turnover and decreased bone mineral density. This condition, often undiagnosed and undertreated, amplifies the risk of fractures, particularly in older men. Diagnosis and management of osteoporosis in men require vigilance and consideration of underlying etiologies such as androgen deprivation therapy, hypogonadism, and chronic medical conditions like hyperparathyroidism or glucocorticoid use. Timely intervention involving lifestyle modifications, pharmacotherapy, and fracture prevention strategies can effectively mitigate the impact of osteoporosis in men. Let us now explore the next aspect of osteoporosis. Bisphosphonates, a class of drugs widely used in the management of osteoporosis, exert their therapeutic effects by inhibiting bone resorption. These medications, including alendronate, risedronate, and zoledronic acid, reduce fracture risk by increasing bone mineral density, improving bone microarchitecture, and decreasing bone turnover. Bisphosphonates are commonly prescribed as first-line treatment options, particularly in postmenopausal women with osteoporosis. However, as with any medication, they come with potential adverse effects, including gastrointestinal symptoms, musculoskeletal pain, and osteonecrosis of the jaw. Careful consideration of patient-specific factors, dosing regimens, and monitoring guidelines ensures optimal use and safety of bisphosphonates. Let us move on to the next topic, which sheds light on the pathophysiology of fragility fractures. Fragility fractures, the hallmark of osteoporosis, occur due to minimal trauma, such as a fall from standing height. Understanding the pathophysiology of these fractures helps elucidate the underlying mechanisms contributing to bone fragility. Osteoporotic fractures result from a combination of compromised bone quality and reduced bone quantity. Age-related decline in bone mass, impaired bone microarchitecture, decreased bone strength, and alterations in collagen crosslinks all contribute to increased fracture susceptibility. Additionally, factors such as advanced glycation end products, oxidative stress, and chronic inflammation further exacerbate the fragility of bones. This comprehensive understanding of the pathophysiology paves the way for targeted therapeutic interventions and preventive strategies. Now, let us delve into the complexities surrounding osteoporosis in postmenopausal women. Postmenopausal osteoporosis warrants special attention due to the accelerated bone loss triggered by estrogen deficiency. Estrogen, a key hormone in bone metabolism, protects against excessive bone resorption and supports bone formation. Without sufficient estrogen, women experience a rapid decline in bone mineral density, leading to an increased fracture risk. Hormonal replacement therapy, HRT, selective estrogen receptor modulators, SERMs, and estrogen agonist/antagonist drugs like bazodoxifene have shown efficacy in managing postmenopausal osteoporosis. Nevertheless, proper patient selection, vigilant risk assessment, and thorough evaluation of benefits versus risks are vital when considering these treatment options. Let us now move on to the next aspect of osteoporosis. Accurate assessment of bone microarchitecture is fundamental in diagnosing osteoporosis and evaluating fracture risk. Conventional dual energy X-ray absorptiometry, DXA, remains the gold standard for measuring bone mineral density. However, emerging imaging techniques, such as high-resolution peripheral quantitative computed tomography, HRPQ-CT, magnetic resonance imaging, MRI, and trabecular bone score, TBS, complement DXA by providing additional insights into bone quality, microarchitecture, and fracture prediction. These advanced imaging modalities enable early detection of bone abnormalities, risk stratification, and personalized treatment approaches. Familiarity with these innovative techniques empowers clinicians in optimizing patient care. Now, let us delve into the next topic concerning the role of RONCL inhibitors in the treatment of osteoporosis. Receptor activator of nuclear factor kappa ligand, RONCL, plays a pivotal role in osteoclast activation and bone resorption. RONCL inhibitors, including denosumab, effectively target this pathway, leading to decreased bone turnover and increased bone mineral density. These biologic agents have shown efficacy, particularly in patients with high fracture risk or intolerance to other osteoporosis pharmacotherapies. However, careful consideration of the long-term consequences, such as potential rebound fractures after discontinuation, is essential. Close monitoring of calcium levels, renal function, and adherence to treatment plans, in collaboration with patients, contributes to successful outcomes. Chronic corticosteroid use, whether prescribed or due to endogenous overproduction, poses a significant risk for developing secondary osteoporosis. Glucocorticoids disrupt bone remodeling by impairing osteoblast function, enhancing osteoclast activity, and promoting apoptosis of osteocytes. Long-term corticosteroid therapy increases fracture risk, particularly in the vertebrae and femoral neck. Adequate calcium and vitamin D supplementation, lifestyle modifications, and bisphosphonate therapy are cornerstone interventions in managing corticosteroid-induced bone loss. Recognition of this association and early intervention are crucial in preventing devastating fractures and preserving bone health. Let us now explore the topic focusing on the role of vitamin K in bone health and osteoporosis prevention. Vitamin K, an essential nutrient involved in post-translational modification of osteocalcin and matrix glyprotein, plays a crucial role in bone mineralization and vascular health. Adequate vitamin K status promotes calcium binding to bone matrix proteins, thereby improving bone strength and reducing the risk of fractures. Observational studies suggest an association between low vitamin K intake and increased fracture risk. However, the clinical evidence regarding the optimal dose, duration, and form of vitamin K supplementation for preventing osteoporosis remains inconclusive. Further research is required to establish definitive recommendations. Let us proceed to our next topic, examining emerging therapies for osteoporosis. Despite the availability of several treatment options, osteoporosis continues to pose challenges that necessitate the exploration of novel therapeutic strategies. Ongoing research focuses on identifying new targets, such as sclerostin, cathepsin K, and the WNT signaling pathway, to develop innovative therapies. These emerging treatments aim to enhance bone formation, reduce bone resorption, and effectively reduce fracture risk. Promising therapies include osteoanabolic agents like romosozumab and blinatumomab, as well as novel anti-resorptive drugs like odinakitib. While these therapies hold immense potential, rigorous clinical trials and long-term safety data are essential before widespread implementation. Let us now turn our attention to the final topic of this script. Following osteoporotic fractures, comprehensive rehabilitation plays a pivotal role in optimizing functional recovery and preventing future fractures. Multidisciplinary rehabilitation programs, including physical therapy, occupational therapy, nutritional support, and pain management, aim to enhance mobility, restore independence, and address fall prevention strategies. Targeted exercises, focusing on balance, strength, and posture, help improve muscle function and bone health. Additionally, calcium and vitamin D supplementation, along with pharmacotherapy when indicated, contribute to the overall success of rehabilitation interventions. A tailored approach, considering individual patient needs, fosters a better quality of life and reduces the burden associated with osteoporotic fractures. In conclusion, Osteoporosis is a multifaceted disorder that demands comprehensive evaluation, meticulous assessment, and targeted interventions. From understanding the nuances in bone turnover markers to exploring emerging therapies, it is imperative for healthcare professionals to stay updated with the latest advancements in the field. By recognizing individual susceptibility factors, applying evidence-based treatments, and implementing holistic patient care, we can strive towards preventing fractures, improving outcomes, and enhancing the well-being of individuals affected by osteoporosis. Remember, knowledge is power, and your commitment to lifelong learning will shape your future practice. Best wishes on your journey to becoming skilled healthcare providers in tackling osteoporosis and enriching the lives of those you serve. Thank you for your attention.